Hello, this is Dr. Do again. This video is alphabetic list problem on letter N. Today I'm going to talk about the group disease of nephropathy. It's if you follow my previous video on letter K, I talk about the kidney diseases. Usually I talk about the interstitial nephritis and interstitial kidney disease, and also the pyelonephritis and also glomerulonephritis. That's what I focus on. I mentioned about the nephropathy, but not in details. So today I'm just going to talk about this, the whole video talk about the nephropathy. And I'm just going to tell what I know about the nephropathy versus nephritis, glomerulonephritis. So it's kind of confused, the concept, but they are all kidney diseases, of course, and I think the difference really is the pathological process. I'm going to talk more about that. And before I talk about that nephropathy, let me just bring up the first priority, whether there's any associated conditions of this nephropathy warrant emergent visit. Usually for the nephropathy is a chronic process, losing protein, and it could be acute process. However, this is really not an emergency disease unless complicated on top of that nephropathy, complicated with other conditions, especially associated with this systemic diseases. For example, if the protein loss in huge amount caused the fluid accumulate in the body. I'm going to explain to you why the lost protein can cause the fluid accumulate, and especially the fluid accumulating in the lung associated with heart disease. So if that's the case, really is the emergency associated with the edema, shortness of breath. Usually that is caused by heart disease, but on top of that, if this nephropathy associated with this heart condition or the lung fluid accumulate, so that's the emergency. Usually when I talk about nephropathy, if it is a nephropathy, it's isolated kidney disease, usually it's not an emergency. So that's my point. Unless it's a chronic kidney disease caused kidney renal failure, so that's another emergency situation. But let me just explain the nephropathy and nephritis. By the way, nephritis or nephropathy cannot manage at home, regardless of the causes or the severity, has to be managed under the supervision by the medical professional, by the primary care physician teaming with the specialist. So that's clear. And the nephropathy and nephritis, what are differences? It's kind of confusing. So the nephritis, we talk about the pyelonephritis, for example, is really the either chronic or acute. It's the retrograde infection ascending up from the cystitis, for example, or urinary tract infection back up to the kidney, cause this fever, frank pain. So this is the pyelonephritis. And there's another nephritis, it's called interstitial nephritis, usually caused by the chemicals or medication damage, and usually it's kind of chronic process. The mechanism is different from the nephropathy, but the concept, the clinical presentation is quite similar, losing protein. And also the glomerulonephritis, I think I mentioned a couple of times, it just usually refer to the post-strep infection. It's not quite common nowadays, but past probably 2 decades ago, it's quite common. Cause this not only lose protein, but also a glomerular damage cause the large component of the blood. For example, the red blood cells can lose with this urine because damage of this glomerulus and the filtration membrane. So then not just the molecules, also the cells, red blood cells can coming out in huge amount. So then nephropathy, on the other hand, usually refer to the autoimmune process or the overreactive immune system. Like I mentioned a couple of times, the mechanism is similar to the hypersensitivity, particularly type 2 and type 3. What that refers to is really either the immune reaction generated the antibody recognize self tissue as the foreign tissue. So either to cause the damage of the membranous structure, or with the complicated complement force the complex deposit around those membrane structure, either focal or diffuse or segmental. Those are really the under microscopic. In general, the nephritis are the inflammations. So under the microscope, you see the inflammatory cells that's probably undergoing the process, and the nephropathy is on top of that inflammation with the autoimmune response. So, wrap it up. The clinical presentation, what is the difference between nephritis and nephropathy? Depends on the cause of nephritis. Glomerular nephritis, for example, losing the red blood cells as the main manifestation of the bloody urine. And for the pyelonephritis, has the fever because caused by the bacterial infection. And interstitial nephritis, probably the three categories of nephritis. The interstitial nephritis really, in terms of clinical presentation, similar to the nephropathy, losing protein. That's the main clinical presentations. And with this loss of protein, what are the consequences of this losing protein to the urine from the body? Mainly the albumin. The albumin is one of the most important nutrients in the body to maintain the structure, to maintain the metabolism, and to maintain the oncotic pressure of the blood. So if this losing protein cause this decreased oncotic pressure, then the fluid will be back up, accumulate. It's a complicated concept, but anyway, so the consequence for this losing protein from the nephropathy is the edema. Okay, the generalized edema, the fluid accumulated among the tissue. The mechanism is kind of complicated because the filtration pressure, the capsule pressure, the static pressure from the blood vessel, and the oncotic pressure from the blood. So these are the concepts, but if you're interested, search the filtration pressure of kidney. You will understand more about why I said losing protein, the consequence is cause the edema. Okay, on top of that, also if the chronic nephropathy caused by the different systemic disease, for example, the hypertensive nephropathy or the diabetic nephropathy, these are conditions because associated with systemic disease, then the damage is worse compared to the autoimmune cause, or vice versa. Depends on the cause, depends on the severity of the disease, either segmental, focal, or diffuse. So anyway, it's really the medical concept. Okay, for the patient, standpoint of patient, what you need to know. If you have this edema without cause, without knowing you feel swelling, you need to go to your physician, check out, make sure it is not this nephropathy caused edema. Or if you have other systemic disease like hypertension, diabetes, just make sure to follow up with your physician, the specialist, and also the primary care to manage the pressure and manage the glucose. So slow down the progress to the nephropathy. Or if you have the unknown causes, this losing protein, edema, and see your physician. And those categories really not have to occur in the systemic disease or in the older people, can occur in different ages. So anyway, this video is kind of confusing, but I just give you some idea. First of all, if you're interested, you can search the filtration pressure of the glomerulus, and also if you're interested, search the nephropathy and find out the causes and also the clinical presentations. In terms of management, steroid probably right now is come to my mind. It's really the common used method for nephropathy, and without systemic disease, the isolated nephropathy. In terms of the systemic disease causing nephropathy, I think I mentioned either hypertension or diabetes. I talked it before, but I hope this video is not confusing you, and hope it helps you. I'm going to stop here. Longer than I thought. I'm going to stop here, and thank you for watching. I'll see you next time.